Hello, and welcome to the Protecting the Village show, brought to you by the Protecting the Village campaign, powered by Treasure Coast Communications and Marketing, and funded by Allegheny Franciscan Ministries. I'm your host, Anthony Maynard, and today we have with us Dr. Wilhelmina Lewis, the CEO of Florida Community Health Centers, and we're going to go ahead and get right into it. Dr. Lewis, thank you for joining us.
It's my pleasure. Thank you for having me here.
So tell us a little bit about yourself. Now, we're working in Lincoln Park specifically, throughout the city of Fort Pierce as well. You're well known and well renowned in that area. And we just want to share with the viewing audience a little bit about where you come from, whether or not you're a native of Florida. Give us a little background.
Well, I am a Florida native. Actually was born in the bedroom in which I grew up in a little town called Clewiston, Florida. I'm the granddaughter of a sharecropper. My mother grew up picking cotton in Georgia. My father immigrated from Jamaica to come to America in search of a better life. And so he wound up working for the sugar company actually as a cowboy in Clewiston. My mom and her family moved in across the street. A few years later, they got married, and here I was, born into a small family at that time that unfortunately didn't have insurance. And so I grew up understanding the impact of the lack of access, or at least the perception of a lack of access to health care. And because of that, you went to the doctor when you didn't have any other options. When a home remedy didn't work, that's when you went to see the doctor. And unfortunately, because of that, my mom wound up developing cancer. It was stage 4, unfortunately, by the time it was diagnosed. Wow. And so my mission in life became to make sure that if it was at all avoidable, that no one else experienced that no other daughter lost her mother far too young as a result of a preventable disease. My father was diabetic. And also did not take very good care of himself. And so I thought it was really important to be able to serve those communities that needed quality health care that was affordable and accessible, and also from someone who could relate to them and hopefully to whom they could relate. So it's been a pleasure to be able to come back to Florida and serve the Fort Pierce community. I came back in 2002, worked at Florida Community Health Center's Delaware Avenue location, and thankfully over time have been able to move into another role in the organization.
Awesome. Wow. I did not know all of that. We're going to have you back just to discuss some of that. But for right now, we're going to go into what we're currently dealing with and what you've currently been doing such a great job handling in regards to the pandemic. Now, working in Lincoln Park, which is an area that is similar in terms of demographics and size and so forth to what you just described in terms of your upbringing. Now, in Lincoln Park, what are some of the unique challenges that you've encountered through your role so far?
I think that some things that we see in Lincoln Park are sometimes access to care, or at least, again, people's perception of their ability to access care. I'm often a little bit saddened to find out that we're one of the best kept secrets in medicine. People don't realize that we have accessibility to primary care for adult and pediatric patients, dental care, behavioral health care. We also have obstetrical care. So they can get care, but oftentimes they don't realize that it's there. They don't realize that they can access it at prices that they genuinely can afford, that they won't be turned away even if they don't have insurance or money to pay. And so that same hesitancy because of perception is there. Sometimes there's also that tension between the medical community and the African American community. Again, if they haven't seen my face or they don't see clinicians that look like them, they may not feel that they can come and just be who they are. Just share who they are and have someone who will listen to them and really be concerned about them as an individual and really want to make sure that that they know that we care about them as individuals and we want to make our community healthier one person at a time.
Okay. You touched on a point there that I wanted to elaborate on a little bit further, because having you in the role that you're in as CEO, I think, is really key, because the underlying concept there, I believe, is trust, right? Or lack thereof, where our community is concerned. How do you feel that you operating in your role has helped to foster some additional trust from the community so that we've been able to tackle the pandemic and give it our best effort where people are actually open to receiving what's being given?
I think because I'm a black woman who's been in Fort Pierce since 2002, I've taken care of a lot of patients in the Lincoln Park community, so they know me. They know that, I am there for them and that I really am concerned about the community and them as individuals. So I have people who know my track record, who know that I'm not in it to do anything other than help them and their family members. And they also know how passionate I am about making sure that the people who are providing care to them have that same sort of heart. A part of the reason that I've gone into this role is to be able to influence that system of care that takes care of them. And so I want to make sure that the people who work with us and for us have that same passion for community, have that same heart of compassion for people, and will give them the same treatment that they would give to their own loved ones, which is what I desire to do. And so even in our recruitment, whether it's of clinicians or other support staff, my goal is to make sure that it's always going to be someone who treats people with respect, with compassion, and who gives the best of themselves to everyone who comes into their presence on a daily basis.
Okay, well said. I know we had Pastor Kenny Mills on previously, and he talked about some of his efforts to bring the vaccine into the Lincoln Park area and also get it actually into people's arms. Now, we know across the nation we've heard different things from different states in terms of the amount of vaccine that they have readily available, getting it actually to the general public, and all of the challenges and some of the bumps in the road that happen in between. At this point, Lincoln Park, Fort Pierce, the state of Florida, period, how do you feel that things are going in terms of getting vaccine in number, in mass, into the state and getting it distributed to the public?
I am encouraged. I think we're doing a lot better than we were at the beginning of the pandemic. A lot of the work that the Lincoln Park pastors have done to really advocate for getting doses into the community, I think has really been impactful and made a great difference. And so that's been a powerful vehicle for getting trusted voices to get resources to the community that I really believe is imperative. I also see that some of the work that my organization is doing, as well as others, like the health department, as resources become available, we're now seeing a higher flow of vaccines into the community. Mm-hmm. As a matter of fact, we were one of the first 250 community health centers in the country to be able to get access to vaccines. And while we're still waiting on those supplies to flow in routinely, we do expect that within the next week or so, we're going to have routine amounts of vaccines coming into our communities and be able to administer those. We'll also have a mobile van, a mobile medical unit really, that we expect to receive at the end of March. Wow. So that will help. And again, I know that there are other organizations that are being pulled together really in a coalition to help with making sure that the Lincoln Park community has access to the vaccine. I think now the big thing is making sure that people have a level of trust so that they are willing to now accept the vaccine, because that's also been an issue that I've unfortunately seen a fair amount of, that although there may be vaccine available, now trying to get people of color to be trustful that the vaccine is safe for them to take has been something that we're still combating.
Wow. Yeah, that's a problem that we've noticed, a challenge that we've noticed, particularly in our communities. And I'm glad that you're doing such powerful work to try to overcome that. One of the things that I heard you mention when you mentioned the health department. So in discussing these things and mentioning you and bringing up the fact that, okay, we're going to be interviewing you, can you give us a little bit of the differentiation between Florida Community Health and the health department, and what those two things do, who leads what you lead versus, I know Mr. Sperber leads the health department, and seems to be a little bit of confusion and overlap because, well, Dr. Lewis is the CEO of the health department. No, that's not necessarily correct. That's not correct. So if you can elaborate on that, maybe we can clear some of that up for the folks.
Sure, I'd be happy to. The health department is actually a state-funded entity that's geared towards really addressing the public health issues that face our community. So things like pandemics, making sure that immunizations are available, tracing when there are particular disease processes like a variety of things. When the Ebola pandemic hit, those kinds, well, thankfully didn't become a pandemic here, but I really mean on a worldwide basis,
Right.
helping us to prepare for those types of public health emergencies. Florida Community Health Centers, on the other hand, is a private, nonprofit organization. We've actually been in business for 45 years. We do receive some funding from the federal government. As a matter of fact, we're what's called a federally qualified community health centers. That means that our board, we have a board of directors. Over 51% have to be patients of our organization,
Okay.
and we are charged with providing high quality care at a low cost to anyone who comes through our doors, whether they have insurance or don't have insurance. If they have money, if they don't have money. We can use what's called a sliding fee scale that's based on the federal poverty guidelines, so their discount is based on their household income, but we are charged again with providing high quality care. So we do a lot of primary care for adult and pediatric patients. Again, I mentioned that we also provide obstetrical services. We're actually the largest community provider of obstetrical and women's health care on the Treasure Coast. We provide dental care. We actually have behavioral health services. They can receive lab services on site. So we have a large spectrum of services that are available, but we are a private practice with what I call a public health interest. And so when we see things like pandemics, although we have our own set of patients, and we took care of over 56,000 patients
Wow.
in the 6-county area surrounding Lake Okeechobee last year. So we could focus exclusively on our patients, but we do have a public health interest, which means that we partner with the health department to bring more resources to bear on the types of situations that you see challenging our community now.
Okay. Well, thank you for that. One of the things that I wanted to piggyback with that on, in terms of misinformation, miscommunication, myths, conspiracy theories, and so forth that are out there, because we hear a lot of that, and I think the general public can have some difficulty placing what's correct and what's not. Can you touch on a point or two that you're consistently hearing, or that's come up a number of times? You say, okay, wait, this is misinformation. And while you have the attention of the viewing audience, anything that you want to just straighten out in regards to the pandemic, the vaccines, or any of that type of information?
Sure. I continue to hear that there are concerns about whether or not the vaccine is safe. And I understand some of the concerns that the community has, especially the African American community, relative to things that have happened in the past that were definitely not to our advantage. So, for instance, you hear people talking about the Tuskegee syphilis experiment, and where African American men were given syphilis, and they were not given treatment for it to see what happened over the course of time as syphilis took its impact on the body. With the COVID-19 vaccine, sometimes we find that people are concerned that that too is an experiment. And I'm here to tell you that it is not. We actually really know and believe that everything we know about the science so far is that it is safe. I've actually had 2 COVID-19 vaccines myself. I've made sure that my family has been vaccinated when they reach the appropriate point in terms of actually qualifying for the vaccine.
Right.
But it is not an experiment on our people. Really, in this instance, we are trying to make sure that the African American community, other communities of color, and other high-risk populations get the vaccine, because COVID-19 is disproportionately killing us, because unfortunately we have the most incidence of diabetes, heart failure, coronary artery disease. All of the things that put people at the most risk for doing poorly with COVID-19 are all of the reasons we should be taking the vaccine. And so I see us not taking advantage of the vaccine at the rate that we should. I also hear concerns about whether or not the vaccine will cause infertility. It will not. It does not impact your fertility. There's been some confusion about the spike protein, and there's confusion about a different protein that impacts the ability of the placenta to develop if a woman is pregnant. There's a different protein that is not the spike protein of COVID-19 that can impact the ability of the placenta to develop or implant on the wall of the uterus. There's been confusion about that. And so the COVID-19 vaccine in no way impacts your ability to have children in the future. Also, other concerns that I've heard are whether or not the COVID-19 vaccine will impact your DNA. It does not go into your system through your DNA. It's a totally different mechanism, and so you don't have to worry about them creating a genetic change in you or in your future generations by you receiving the vaccine.
Thank you for that, because we've heard from legitimate concerns to borderline extreme. So that clarification is definitely needed. I wanted to pivot a little bit and touch something that's related. I know you're a woman of faith, and I wanted to see if you would be willing to share a little bit from that perspective, because I know the faith community has had some questions where the vaccine is concerned, and again, they range from, practical to not so practical, let's say. And I wanted to get your take as a woman of faith on that.
And you're right. I am a woman of faith. I am a Christian. I'm actually ordained as a minister in terms of praise, in charge of praise and worship for my local church. And so that's something that's a critical and important part of my life. And so I have these conversations with my own pastor about whether or not it's safe for us to continue gathering, whether or not people should be getting vaccinated. And I say unequivocally, yes, we should be getting vaccinated, and no, we should not be meeting in person. It is still not yet at a point of control where it's safe for us to be gathering in large groups. And unfortunately, I've seen both in the local community as well as the broader faith community instances of just giants in the faith who have passed away from COVID-19 because unfortunately it's not a respecter of persons. And I've seen Christian and non-Christian people of other faith and people of no faith at all be unfortunately negatively impacted by COVID-19, whether it's causing them severe illness, serious illness, or unfortunately death. And so I think this is one of those instances where we have to also know that Jesus used multiple methodologies for healing. And my pastor even says, prayer and pills work good together. So, right now I would say that prayer and a COVID-19 vaccine work good together. And I believe in putting both to use as we battle this pandemic.
Okay, thank you for that. I want to go to now the actual congregating of individuals, because one of the things that we see, we talked a little bit off camera about the period in terms of weather, the seasons that we're going into, and it's typically a time where people get to congregate. We have a lot of people coming into Florida, going to the beach. You see a lot of the pictures in the newspaper where there's some really significant crowds now, and a lot of them are not wearing masks. And I wanted you to touch a little bit on what type of hindrance to us getting to a place where we have extremely low or no COVID numbers does that sort of interaction present?
It's dangerous because the whole purpose of getting a large number of people vaccinated is to get to what you've heard called herd immunity, which essentially means that there are enough people who are immune to the disease or to the illness that you have less concern about its ability to spread quickly. When you have people who still have not yet been vaccinated now starting to gather in large groups, you increase the risk that the illness can spread still quickly amongst that group. And so while we were pulling down the numbers by beginning to have people vaccinated in larger numbers, you're taking it in the opposite direction when you start to have people gather together in large groups, especially if they're unvaccinated. So unfortunately, my concern is that we could start to see some erosion of the gains that we've made. And I believe it could take longer for us to get to that place where it's safe for us to gather together in groups again as a result of exactly what you described. Now spring breakers coming and having these large gatherings, or people are so excited because one or two of their group got vaccinated, but the bulk of them have not yet, and now they're starting to gather when it's still unsafe.
Yeah, and it's beginning to have personal impact on a number of people. You covered that in an excellent way. That's great information. I know for myself personally, recently lost a good brother who actually operated in Lincoln Park, Brother Greg Davis, called him the Crab Man, and a good friend of mine, and we missed him terribly. And it was just like that. One minute you hear a person isn't feeling well, the next they're in the hospital, and give or take their underlying conditions in certain situations, they may not be here anymore. That being said, the death rate at large and what we've been dealing with and actually losing people to COVID, where are we with that? Has that rescinded any? Has it gone down? Is the rate less? Or how are we doing with that in our state now?
The death rate is starting to decrease, as is the rate of positivity.
Okay.
So at some points, even with our own testing, and usually because we're testing a more vulnerable population where there's higher likelihood of being infected, our rates would typically run a little higher than the states. So I would say our rate is now about half of what it's been at its highest in the state of Florida. Now you're seeing about an 8% positivity rate, and you're seeing fewer and fewer deaths. But again, the concern is if we don't allow ourselves that breathing room to get a mass of people vaccinated, that we're going to potentially trend in the other direction. I hope it's not the case. Again, we're starting to see a greater rollout, a faster rollout of vaccine. So, we hope that we, especially with the greater availability of vaccine and now the Johnson & Johnson vaccine, that's one dose. So, there's less difficulty getting more people vaccinated in a certain span of time. My hope is that we'll still be able to work faster to vaccinate than we can to erase the gains of vaccination.
Okay, let's hope so. You touched on one thing that you mentioned, Johnson & Johnson. I wanted to go back to that because I've heard a number of people talking comparatively. Well, I don't want the Johnson & Johnson. I don't want to deal with the Pfizer. Give me the Moderna. Can you talk a little bit about the comparison of the three vaccines, if there's really any difference, if one is better than another, to provide some clarity there?
Sure, I'll be glad to talk about the differences, but first let me say, whichever one you can get, take it. Whichever vaccine you can get,
That's right.
Let them administer it to you. But to just speak more specifically about the vaccines, both the Moderna and the Pfizer vaccines utilize what's called this messenger RNA technology. And some people have had concerns about that because they think it's a new technology. It's actually been out over 10 years. Okay. It's technology that they're using to actually try to work on some cancer treatments. And with that technology, you're able to make larger volume of vaccine faster. And so that has been fantastic for the needs of the pandemic. The Pfizer vaccine can be used in individuals as young as 16 years of age, and you get your repeat dose in 21 days. So you need 2 doses of the Pfizer vaccine. Okay. The Moderna vaccine, you can't be any younger than 18 to take it. And that vaccine you actually repeat in 28 days. Okay. So those two are the most similar in that both require 2 doses, again, one of which is 21 days, one of which is 18 days. They're also both about 95% effective in terms of preventing a case of COVID-19. The Johnson & Johnson vaccine is actually a 1-dose vaccine. It also can be given to someone as young as 18 years of age. The difference is that in the lab, so to speak, it's a little bit less effective in that it's about 70% effective in the lab. But what you're really looking for in terms of these vaccines are their ability to prevent you from getting sick enough to have to go into the hospital or from dying. So with the Johnson & Johnson vaccine, it protects, there haven't been any cases after 4 weeks in terms of if you've received the vaccine 4 weeks after that period of time, there haven't been any cases where anyone has gotten sick enough to be in the hospital or dying. Okay. And the stats show that about a 95% chance of preventing those 2 scenarios. So again, whichever vaccine you can get, go ahead and take it. All the information we have at this point in time is that they're safe. The Johnson & Johnson vaccine is a little bit different in terms of the technology behind it. It's what's called an adenovirus vector, but it still cannot give you COVID-19. It cannot give you an illness. It does the same thing in terms of making sure that your body recognizes that spike protein on the COVID-19 molecule. And so when you look at the molecules, if you've seen pictures of them, it usually looks like a ball that has these little spikes on the top. And basically, each of the vaccines teaches your body to recognize that spike on the top, and when it sees it, to destroy it. Okay. And so if it has a COVID molecule attached that could have made you sick, your body's going to destroy it.
Okay. Well, thank you for that. We have funded through Allegheny Franciscan Ministries. This is the type of information that we're trying to get out to as many people in Lincoln Park as possible. We do that through the LincolnParkGuide.com. That's one of the ways. We have this Protecting the Village show. We have the Protecting the Village radio show. So we're trying to, bombard the airwaves and the internet. We do social media. We're trying to get as much of this information out as possible. While we have you here, before we let you go, is there any other information that you want to help us get out through our channels? Whatever we hear that comes from you, we post on the LincolnParkGuide.com. If there's anything that Florida Community Health has coming in the future or is currently working on that you want to share, now would be a good time to do so.
So thank you for that opportunity. And we're really excited again about our opportunity to provide more and more COVID-19 vaccines to the community. We still have COVID testing that is free of charge to people, so they can actually get drive-through testings, and they can go to our website, www.fchcinc.org, to find out the locations for those tests. Again, there's a wide variety of primary care, so if your family doesn't have care, we want to make sure that you have access to high quality care and know that you will not be turned away no matter what your financial situation. We actually just opened a new center here in Port St. Lucie on Friday on US 1 to open up for even more obstetrical services. We have pharmacy services. That means that you can again get medications that you might not otherwise qualify or be able to afford. So please just check us out, not because we're going to get rich, because clearly if we're not turning you away, if you don't have money, we're not going to get rich. We're here because we want to make sure that you have access to high quality and affordable health care. If you have insurance, great, we'll take great care of you. If you don't have insurance, that's okay too. We'll still take great care of you. The most important thing is to make sure that everyone in our community knows that they have access to high quality health care that they can afford, because I don't want anyone else to experience what my siblings and I did with a loved one passing away from something that could have been caught earlier if only they had been in medical care.
Well, thank you again for that. Congratulations on the new location.
Thank you.
We really appreciate you joining us and the hard work that you're putting in terms of building trust in the community and keeping us as healthy as possible, getting people vaccinated so that we can get to some of our what we will call as normalcy in the community. I think moving forward, given the virtual environments now and so forth, things may continue to be a little different, a little new, but that's okay as long as we're all healthy and doing well. This has been the Protecting the Village show. We thank you for joining us, and we will see you again next time.